Good evening, and welcome to our third series of Edmonston Talks. I am here with our police chief, Chief Harris, and I am Tracy Gant, the mayor of the town of Edmonston. This evening, I am joined by our expert panelist, Ernest L. Carter, Dr. Carter, MD, PhD, health officer, Prince George's County, and also Director Ronald E. Gill, Jr., MS, CEM, Director of the Office of Emergency Management of Prince George's County. Both Dr. Carter and Director Gill work closely with County Executive Angela D. Alsobrooks and the executive leadership team to lead the county during the COVID-19 pandemic. Also joined with us is Jamie Hill Daniel, MD. She's the Associate Program Director of Community Health, MedStar Georgetown Washington Hospital Center Family Medicine Residency Program. She has a practice at the Fort Lincoln Family Center in Colmar Manor, Maryland.
All right, thank you to our expert panelists. We're going to go ahead and get started on segment one. And one of the things that we want to talk about, we all experienced this in the beginning of the year. This pandemic hit us hard in many different ways. You know, a recent article in the Washington Post talked about over 200,000 now confirmed deaths in our nation. I want to get you all's initial reaction. If we could start with Dr. Carter, your initial reaction to the pandemic when this all first started, your initial reaction.
Well, my initial reaction was that of I was really fearful, to be perfectly honest with you, because it was in January when there was a lot of talk about the virus being in Wuhan, China. And then what I knew is that this virus had the potential of becoming a pandemic. And if it hit our shores, we were going to be in trouble. And it turns out that when it first showed up in California and in Washington State, that's when we had to spring into action. I actually was on vacation in early February and got back on about the 20th. And we had to go directly into action because the truth of the matter was if we didn't go into action and if precautions weren't taken in this country and it had spread to Prince George's County and we weren't prepared, we were in danger of losing tens of thousands of lives. And we knew that. So we knew what we had to do was first make sure that we communicated to the public what they had to do. And that was they needed to be at home. We knew that the government, that all things were going to have to shut down, and people going from where we were not, being okay to all of a sudden having to shut down was a major event. And we had to not only convince our executives and our mayors, and we had to convince everybody that this is like a tidal wave getting ready to hit us. We are going to have to communicate that. So the first thing we did was we opened up our HDOC, which is our Health Department Operation Command. We got our communications person ready saying, this is going to really be big and you need to get to work. We also turned to our preparedness people and said, do we have PPE? How are we going to communicate with our hospital systems? And the most important thing I did was I got in touch with Ronnie Gill. So I know he's getting ready to talk in a minute, but he is the director of our emergency management. And at first I was sounding the alarm bell. The first person who heard me was Ronnie, and then we are inseparable since then, because we knew from the health department standpoint that if we didn't get people to first shut down and isolate, and then ultimately now we're social distancing, we would have realized thousands and thousands of deaths. And currently we have 810 deaths, which is 810 deaths too many. But we know that if we hadn't done and gotten panicked when we first did, and honestly, I was panicked. It's like standing on a shore on a sunshiny day, realizing that a tsunami is getting ready to destroy the whole town. I knew that we had to batten down the hatches and make sure everybody understood this was coming. So that was my initial reaction. And in terms of my job, it made me have to ignite a whole lot of systems that we didn't currently have turned on, but we had to turn all those systems on. Operations, logistics, finance, communications. Everybody had to turn from what they were doing and get to work on what we were doing right then and there, especially planning, because everybody had to work simultaneously, knowing that when this thing hit, we are ready. And so that's where we were. That's what we started in late February and into March.
Wow. Wow. For me, getting appointed just in December of 2019 as the police chief here, and then immediately, I have all these programs I'm about to start. We're about to get the ball rolling, and bam, we're about to shut down, and there people didn't know what to do. And to hear the leadership from Prince George's County, particularly to hear you all on these calls and really guiding us on the things that we needed to do to prepare for, on the things that we needed to advise our residents was really important. Dr. Hill Daniel, same question to you. Your initial reaction to the pandemic.
I think very much like Dr. Carter said, it really felt like a wave, just watching a wave come over the community, because we just had to figure out how were we going to keep our patients safe and how we were going to get the information out to our community, to people who are already marginalized, who are already sort of on the fringe, who don't have technology and don't have access the way many people do in other parts of this area. So, we talk about telemedicine and other technologies that were implemented during the pandemic. Not all of those technologies were available to everybody. So what do you do to get the word out, to ensure that people are still getting medical care, to ensure that they understand what's happening to them? And, it took a lot of creative solutions and people coming together to try to, just call people and work within our systems and work within our communities to work within the schools and community groups and churches to reach everyone and tell them how important it was to start, social distancing, stay at home, protect themselves. So yeah, I do agree with that analogy of the wave and just trying to take cover and protect.
Wow, absolutely. And Director Gill, let's get you in on this. This was a lot for our county to digest, a lot for us to handle. And there was even articles about how minority communities were affected the most. When this first happened in your leadership role, your initial reaction.
So similar to Dr. Carter's, while he found out in January, I was still managing other types of events that were going on in the county. And our initial conversations, and that was across the entire EM versus health department platforms. And late February, Dr. Carter and I met and we talked about where we were going. I wasn't around for N1H1 and some other types of pandemics, so this was going to be a new experience for me. What I was very comfortable was we had two people, one person who was the clinician and knew how to handle it from the medical perspective. And where I was comfortable, I have years of experience in managing events. So I think by putting the two of us together, really, while it's been a struggle because of long hours, long days, different things popping up, we work very well together to make sure we have what we need. One of the first things we struggle with as we listen to it all across the country was PPE, N95 masks, ventilators, just things we knew we would need for this event. And while it was a struggle in the beginning, we've done a great job of one, having enough equipment for the emergency, but secondly, now beginning and having that surplus as we prepare for the second wave. One of the things that that a lesson learned from many of the experts are saying that the second wave is going to be larger or bigger than the first wave. So if that's indeed the case, we've been there, we're here now, and we have taken the steps to make sure all the equipment we need or we should have, we're beginning to make sure it's in our warehouses, it's going to hospitals. If you can call it hoarding, we're stacking. So when this thing rears its ugly head again, we will have what we need.
Wow. And so if we start talking about for those folks who are listening who just don't know, if Dr. Hill Daniel, if you could explain to us, and Dr. Carter, you can jump on in this if you can, what is the coronavirus? Can you explain to us what the coronavirus is? What is COVID-19?
Sure. So coronavirus, it's very similar to other viruses in that same family, similar to the common cold virus. But this particular strain has shown itself to be very virulent in the sense that it is spread through respiratory droplets, so very easily transmissible, which is why, the masking is very important, the social distancing. It's thought to spread by any prolonged contact. So if you're around someone who's infected with coronavirus for a period of 15 minutes or so, and you're in a conversation with them and not socially distanced, there's a good chance that you can contract the virus. And the other part that makes this virus is so different from other viruses is that you may or may not manifest symptoms, and symptoms can range from mild cold symptoms, runny nose, scratchy throat, to no symptoms, all the way to respiratory failure. So it's really hitting the community and hitting people in different ways. And so I think that is one of the things that's making it so challenging, is because as we move into flu season and even allergy season right now, it's allergy season, people don't know, am I just sniffling and have a scratchy throat because it's allergy season? Is this a cold because the temperature is changing? Or now was I somehow exposed to coronavirus? And I think that is the confounding variable with this virus that is making it so challenging to really track and defeat and get a handle on. And, symptoms can progress quite rapidly, and, person can go from having mild symptoms to being in the hospital in a matter of days. And I think that is, again, like I said, one of the things that's very challenging. So we just urge everyone to take, every precaution and treat it as a real threat.
So I appreciate that. Dr. Carter, if we were to look at how can the public sort through some of the misinformation versus the actual science-based facts? When the pandemic first happened, we heard so many different things, and for our residents, what can they do to sort through the misinformation and really understand the importance of the pandemic? What are some of the resources they can tag into from your office or anywhere throughout the county that can really provide them the science-based information that's needed to for any precautions that need to be taken?
Well, one thing I will say is that other than going to the sites like the county's website, or going to known university sites like Johns Hopkins or or Stanford, those are the sites you go to. Otherwise, stay off the internet because there's a lot of misinformation in the internet. That's number one. Number two, if you're listening to somebody, listen to a person who's a known expert like Anthony Fauci. He is a known expert, and when he speaks, he tells the truth. He's not going one way or the other. He's telling the truth. What I try to do, and what I know Dr. Hill Daniel does, and the health professionals out there now, what we're trying to do is tell you the correct information. So the health professionals are the folks who are going to tell you the straight. There's no agenda, hidden agenda for health professionals. They're here to tell you the truth. And my job is to make sure I convey that truth to the public and to our executive, and to our legislative branch, and to whoever will listen, we try to convey the truth. So I would narrow I'm going to overemphasize, narrow your sources of truth. There are certain ones, like for instance, like you said, if you're going to listen to somebody, listen to Anthony Fauci, because the people, Anthony Fauci, and especially the folks at the NIH, are going to tell the truth. There is a lot of misinformation, and you got to be careful because this is highly politicized. So I think I would start there to tell you those are really the sources of truth. Even on the news, they'll sometimes mix in one or two things that'll skew your thinking one way or the other, or influence you in the wrong way.
Thank you so much. That will conclude us in our segment 1, and we appreciate everybody's comments on the initial reaction. I'm going to turn it over to our mayor to lead us in segment 2.
So we want to talk about budgeting and planning and implementation. So Director Gill, we talked about PPE. So ensuring adequate PPE nationally, it was a problem initially. And for Maryland, I know that our governor and his wife, they secured some PPE gear with foreign friends. They stepped in and they kind of helped us out. Was that a good thing? Did that really help us in a way? Was that a good move, do you think, Director Gill?
So I'll let Dr. Carter answer the question about the kits, the test kits. Regarding PPE, there were struggles from the beginning. We all have, especially the N95s, we have a fair amount of N95s, surgical gowns, and things of that nature. And normally when we have an event like that, we're taking care of our public safety, first responders, the health department, folks that may be in forward facing with the community. With this event, we had hospitals that were running out of supplies that we normally don't service, healthcare facilities running out of supplies that we normally don't service, and the county running out of, quite frankly, the county running out of supplies. The way the process works is if Prince George's County ran out of materials or could see that they were running out of resources, we reach out to the state, the Maryland Emergency Management Agency. When MEMA runs out of equipment, they reach out to FEMA, Federal Emergency Management Agency. In this instance, because we knew what we were having, they were getting stuff from the Strategic National Stockpile to send to each one of the states. It was such a delay with a lot of that stuff arriving that the state couldn't distribute to the local, and the local couldn't give to hospitals and some of our other partners. So eventually, when you had, and you remember, New York and New Jersey were really taking a beating. So the stuff was going there, and Maryland wasn't looked upon as needing a lot of that equipment. So I would hope, and prayerfully, I would hope the federal government, and we all see what's going on, has learned their lesson to get, as we prepare for this next wave, to get stuff out. And the same thing at the state level. One of the things that we've done, and here's an example of something that we've done. When we had the first event, and Dr. Carter can correct me, we may have had 20,000 N95 masks. And to serve what we needed to do, even to our municipalities and others that government that may need masks, that's what we were working in. Right now on our shelves, we have approximately 1.1 million N95 masks. So, and the same with surgical gowns, the same with gloves, the same with hand sanitizers, and it's stuff that we will need for this next wave.
Uh-huh.
piling, so
Great.
we're prepared.
So we're in a good place as far as our
I
masks.
believe we are.
Very good.
I believe we are.
Very good. Yeah.
So just
Dr.
to,
Carr?
yeah, just to say a little bit about the testing. So when, when I was telling you that I got that pit in my stomach when I knew
Right.
this was coming, the federal government at the same time should have, and I'll just have to say it plainly, have the same pit in their stomach, and they should have, just like what they're doing with the vaccines, putting a lot of money into getting our industry to ramp up and get a vaccine done. They could have done the same thing with testing. We could have had millions of tests ready to go. But the problem was they didn't do that. And they were promising 1 million tests here, 4 million tests there. I don't know if you remember. And that wasn't going, and none of that was going to come to us. So all of a sudden we were in a position where we needed to do massive testing when we had no tests. So the state decided that they would take action. It turns out that the test kits that they brought in, you need more than just the kit. You need the reagent, and then you have to have a laboratory to actually run it, do the whole process. Right. So you have to have everything. So they had the kits, but the whole process, and these labs weren't ready for it. They weren't ready for the massive numbers of tests that we needed to do. And so when we were making the demands on the labs said they said they couldn't deliver. The state was doing almost everything they could. They were in a mode where the state lab knew that it couldn't possibly do what needed to be done. They were trying to see how outside folks could do. The outside folks, as Ronnie said, were trying to figure out how they were going to supply New York and the West Coast, because they were going, off the rails. And so we were looking for vendors, any lab that could give us the gold standard so that we can make sure that when we do a test, it's a good test, not just, you didn't want to work with just any lab. And it had to, those labs had to be vetted by the state. So that was a really tense time in American history, to be honest with you. Because the federal government completely failed the states at that point. They had to step up to do it.
Are we in a better place with our testing now?
Yes, we are in a much better place now. We have many labs that have stepped up to the plate so that we can do the gold standard is what you call a PCR test, where people don't like it with the nasal swab, but it is the gold standard. We have other tests that are coming, the saliva test, if you heard, and that is plus or minus in some areas. All of the things that the health department use has to be vetted by the state. But there are point of care tests that folks are using, and now we also have antibody tests. We can talk about those things, but right now we have adequate amount of tests, which is adequate. It's enough for us to be able to make decisions about what we need to do next. And if we didn't have that, we would be really in the dark. So I will have to say that we're right now preparing for that second wave. We have enough tests. Now, we could use a whole heck of a lot more. I'm not going to say that that's not true, but we have adequate amount. And we are asking for our folks to continue to get tested, because we've actually done about 300,000 tests in Prince George's County. The county itself has done about 45,000. So we've done about 60%.
Dr. Carter, I'm sorry, let me cut you off. You said we're asking our folks to get tested.
Yes.
Be specific.
If you feel sick at all, and you can't tell, you won't be able to tell whether you have the flu or what you have. If you feel sick, go to your doctor, get tested. We need for folks to continue to get tested, and not if you just not get tested if you have symptoms. If you have symptoms, you need to be tested.
So that's something we should put out.
Yes.
That's a sort of a program that we should put out. And Dr. Hill Daniel, I feel like you want to say something.
Yeah.
I feel like something's on the edge there.
Yeah, I do want to say something, because I want to go back to what Dr. Carter was saying earlier about misinformation. And that was really one of the paramount issues in the beginning of the pandemic back in the spring, is that we had to restrict testing so much to prioritize to first responder, healthcare workers, nursing home staff, that so many people in the general public were turned away for testing. People who were calling us, who were coming to the clinic, who were symptomatic, that just weren't sick enough to qualify for testing at that time because the limit of testing capacity was so small that we missed our opportunity to get a handle on it. And so now that we do have the capacity, Dr. Carter's 100% right. If you have a question, if you're unsure if your symptoms are related to COVID or the cold or allergies, call your doctor and just find out. We have self-swab tests in my clinic. You don't even have to have the test all the way up your nose. You can do the self-swab. You'll get the results back in a couple of days. There's so many different things that are available now that are high quality tests that people can do and have access to for free.
Because I kind of want to stay here for just 1 second. I know we're talking about budget planning and implementation, but this is important because we're getting into the flu season. So we're going to have people coming up with colds and flu symptoms. So you're saying if they feel, if they start to cough, if they feel the runny nose, if they're feeling tired, those kind of symptoms, with or without a fever, they should go get tested.
100%. Call your doctor, and even your doctor may or may not recommend that you get a test based on what you tell them, but go and find out. That is the point I'm trying to make. Go and get the medical care first and find out.
Okay. That makes a lot of sense. And that's the kind of information we need to give. I'm sorry, Dr. Carter.
No, I was just saying, I agree with that 100%, because with COVID-19, you could have chills and fever, and that's it. Or you can have a cough. You can have shortness of breath and difficulty breathing. You can have body aches and pains. You can have a headache. Then you can have a loss of taste and smell. You can have a sore throat. You can have diarrhea, nausea, and vomiting. You can have, just be congested. All of that could be COVID. But one thing, if you do really have difficulty breathing, you're getting short of breath and you're having persistent pressure in your chest, or you get a little, even if you have confusion or you have an inability to wake or to stay awake, you need to be seen immediately. And all of those signs, all those symptoms should result in a test, in a COVID test. Somebody, because it's just impossible to know that you don't have COVID. So so I'm really, so I want to be sure that folks understand that. And Dr. Hill, Daniel, was absolutely right. When we were first doing this, we didn't have enough tests, so we had to reserve everything for first responders. But if we had enough tests, we would have been testing every last individual we possibly could, because that's the way we would be able to understand how fast the virus is spreading, how to making sure that we are really controlling it. All of those things are important, and it's still important because we are not out of the woods. So we need to continue to test.
So I have one more question for you, and then I want to go to Director Gill with the testing. So we really need to push that the testing, and that's so very, very important. How sure is taking the temperature every morning? I know that a lot of buildings have this practice of taking the temperature. Is that sure?
You mean when you say sure, does that mean that if you don't have a temperature, you don't have COVID?
Right.
No, you cannot have a temperature and definitely have COVID.
Right.
It's just one screening tool. So most places are combining a screening tool, which is a series of questions to say, are you congested? Did you feel sick last night? A whole bunch of questions that they're going to ask you. Plus, then they'll take your temperature. If the temperature is normal, but you fail the screening test, you got to go home. If you have a fever, but your screening test looks normal, you got to go home. So it's just one variable, but it is not the end all and be all for screening.
Okay, I'm getting a little excited here, and I'm gonna slow myself down 1 second, Chief. I'm sorry, but so for those offices that are open every day, and they think that taking a temperature every day means, okay, come on in, I'm gonna take your temperature. Okay, we're good, we're good, we're good. And we have our mask on, we're cool. What's a good practice? I know masks are a great practice. Social distancing, great practice. If you have your individual office, great practice. What's another
Well, the
good
gold standard
practice?
is your 6 foot. If you remain 6 feet from somebody all day long with a mask on, you should be able to avoid the COVID virus, not unless you're cooped up in the room with absolutely no ventilation and you take your mask off and you happen to start singing or you start coughing. Then your 6 feet might not matter. But if you can stay in a well-ventilated room 6 feet apart with your mask on, and not, and you should be okay. But we're asking folks, don't come to work though. If you feel sick, you got a temperature or anything like that, you shouldn't even be at work. You should be feeling really good. Come to work. They'll take your temperature to make sure that you're not lying, or you may not have known you'd had a temperature and you have one, you had to go back. But if your temperature is fine, you should have a screening tool to say, tell your employer that you actually do feel fine. You come to work with your mask, you stay 6 feet, you're gonna be, that's the gold standard. That's what we have right now.
I would just like to chime in 2 things on that point.
Let me finish one thing.
Oh, I'm sorry.
The only other things you have to be sure you do is clean your surfaces. Because if you don't clean your surfaces, then, so you have to make sure your surfaces are clean, and you have to wash your hands typically every hour. You need to get up and go and wash hands, come back into work. You should keep your hands clean. You should keep your surfaces clean. All of those things are important. The other important thing about buildings is they need to be better ventilated. You have to have, for the most part, that's why outdoors is better than indoors, because indoors aren't ventilated well.
Right.
And even though, when we first said we did droplets and everything, there is an aerosolized component to the COVID virus. That's why the mask helps you with 65% prevention, but you still got to worry about that. So if you got to stay 6 feet away, keep your mask on. But if you're inside it, it's nice to make sure that you are adequately ventilated. So those are the things that you sort of worry about. I'm sorry, go ahead, Doctor.
Stuff. Some good stuff here. Yes.
Two other things I would mention. Newer data is coming out on eye protection. So depending on the industry you're in, wearing eye protection is good. So you see a lot more people wearing goggles around. It's a must in healthcare industry. So wearing eye protection when you're out, especially if you're in a service industry, you're serving food, you're around people. And the other thing one of the hidden things that people don't recognize is when you're on break, when you let your guard down, when you sit down in the break room and you want to eat your lunch, that is a place where transmission happens because you've got to take your mask off to eat. You probably spread out, you're sitting down at a table, and those instances where you let your guard down and you're having lunch or you're chatting with your friends at work, those are the times when people can get sick. Because again, that's the people who seem healthy, who are asymptomatic carriers, can transmit the virus. So, it's uncomfortable, but even around my office, we go and we sit in our cars to eat. We spread out in the offices. It's really about maintaining that vigilance all the time, 100% of the time. Just don't let your guard down.
Yes, really, really, really good points. Thank you. I love that segment. Thank you, thank you, thank you. And yes, Director Gill put a thumbs up. Oh, you were talking to someone else. Okay, great. We can really, I do have a question for Director Gill, and thank you for that information. That was really, really good. We can still move into our third segment. I know that the Grays are giving me the cue cards to say, let's move into our third segment. And the question that I have for Director Gill will take us into that third segment, and it's policy and preparedness post-COVID-19. Director Gill, for preparedness, emergency preparedness, a lot of lives have been lost due to COVID-19. We have had a lot of individuals that have been ill due to COVID-19, coronavirus, and they have not, it took them by storm. I mean, they didn't know that they were going to get sick. I mean, it just came upon them, you know. And some people have been, what happens is with that, you're isolated and your family can't get to you. And who knew that you wouldn't live? So you didn't prepare. And we're talking about individuals that were in their 40s and 30s and even 20s. So who were we going to contact as a municipality? Who were we going to contact as your employer? Well, you know, you may have a beneficiary form as an employer, but looking ahead, we need to prepare as a municipality for that. So we need to set things in place for our residents. We're thinking about those things. What are your thoughts on that for municipalities and other, not just municipalities, because, you know, we have unincorporated areas, but going forward for COVID-19, and even we just dealt with a flood and a flash flood where individuals lost everything. What if their home was floating down the river, you know, and who are we going to contact? So what are your thoughts on those things, but specifically COVID-19, because individuals were not able to touch their family. Their families were not able to get in touch with them. What are your thoughts on that?
I think it's a couple of things. And many events we've had before, the majority of them are weather type events. And what we try to do is work with the municipalities and all of our partners before the emergency, during the emergency, and after the event. This one was a little different because I didn't have those materials to give to residents, but the reality is it could have been some of the materials, except for specific to COVID, that would have still worked. We could have sat down with residents to say, do you have a communications plan? If somebody doesn't hear from you in 12 to 24 hours, which one of your family members are going to be knocking on your door? Things such as that. So once we slow down, we'll take that same footprint we did with you know, just in preparedness and move it over to pandemics. But one of the things I wanted to share with you about when we had the derecho, one of the biggest problems we had after the derecho is I was so focused on the entire county and trying to deal with the county and at the same time deal with each individual municipality. Following the derecho, I brought a person on, and that person was the municipal liaison. I don't know if you've gotten anything from Alex Harris, but she's the municipal liaison. So what her job is to do is to, if the chief says he needs a plan produced, that person would help the chief and his team write a plan. If he wanted to do exercise, if you, Mayor, wanted to do an exercise in your community, we could not do the entire exercise, but we could sit down with your folks and put that exercise together and participate in that exercise. So every step of the way, when you're talking about preparedness, training, exercise, and planning, those are the things we want to make sure each municipality has. So going forward, you know, once we slow down from the COVID event, we surely will reach out to you specifically. But if you ask what that plan looks like, I think the first step is making sure each resident has a communications plan. So they would never go 12 hours, 24, 36 hours without having conversation with somebody, or somebody's knocking on that door.
Good. That's important. Go ahead.
Wow, that was great. There's a lot of important information there. I know that Mayor Gant, originally during my appointment, we talked about emergency management and plans for our town. And when the pandemic hit, it just showed how important those plans are to be able to guide our residents in the proper directions. If we move on one of the things we saw in several articles was that minority communities were affected hardest during the pandemic. Dr. Hill Daniel, is there a reason for that? Can you talk a little about that?
Well, I think a couple of things that you see when you talk about the disproportional death rates among minorities, it's the comorbidities, right? We already know, in particular, when we talk about Prince George County, our residents are sicker in general. They have more comorbidities in terms of diabetes, hypertension, COPD, just chronic disease that, you know, adding insult to injury, that they're going to do worse. And again, add that to lack of access to care, that just confounds things. And then misinformation, distrust in the medical system in general, all of those things play into just worse health outcomes. And so without having a system of reliable healthcare that people can trust and turn to in times like this, there's really nothing else that you can expect. And, you know, when we talk about the tidal wave coming, that was the one thing that I thought was like, when this comes in our community, what are we going to do? Because there's no safety net. Like, the safety net is really not designed for our community just to support people the way it should be. And it's a broken system. You know, people don't have insurance. If you don't have insurance, you're not going to the doctor. You're not going to the doctor. You're not taking care of your chronic illness. You're not going to the ER because you just can't afford it. You know, going to get medical care bankrupts you. So of course you're going to suffer more. And those are the things reasons why it affects our community worse. And until we figure out a better way to serve people the way they need healthcare, and the way we can put infrastructure to make people live healthier in general, it's always going to be like that. You know, right now it's coronavirus. It's going to be something else.
Wow, Dr. Carter, if we turn towards you, we kept hearing from the national media sources that we were close to a vaccine. Can you talk a little about that? How close are we really to a vaccine, and what does that mean?
Well, when they say close, it's a long way from being close to a vaccine and being able to distribute vaccinations and vaccinate people. So being close to a vaccine means that we've got a vaccine that potentially will withstand the clinical trials that need to be done, or we're in the process of doing the clinical trials to be able to show an effectiveness of this vaccine. So we're saying that this vaccine can be used in a clinical trial, be effective, and we can show its effectiveness, and then ultimately show that it does not have any sequelae, meaning signs of detrimental effects. So that to say that once you say that all of that is true, then you can then go out and vaccinate somebody. But you've got to go through that the work that shows that not only did I develop it in the laboratory, and now I've tested it on my animal model. Now I've got it. I'm going to these trials where I'm going to test a small population, see what happens, and see what happens to them. Then I got to do it on a larger population and vaccinate them and see what happens to them over a period of time. And then you can say that vaccine is ready to be distributed. It's a long way between saying we have one, now let's go do X, and to say it's ready to go to be distributed. So a lot of this is language. So before in November, these drug companies may say, we have an effective vaccine because they've done a small group of folks and they've seen a certain amount of efficacy. That doesn't mean that they're ready to put it in your arm. All it means is that they are, they've got something they think will work, and there's a lot of scientific evidence that they are able to show its efficacy. There's going to have to be a lot of showing me. I'm just going to tell you the truth. Me and people in my position that this is a safe, effective vaccination that can be put in somebody's body before we start doing anything that looks like mass distribution of a vaccination. So I just want you all to know that.
I'll call him.
Yeah,
Well, I'll take anything. I'm calling Dr. Carter.
People may be rushing to do extra, but I'm going to tell you that because in this, a decision like that has to be based on solid science.
Mm-hmm.
There's no shortcut to solid science. It's just not. There's no shortcut to solid science, and it's not. And so, if the science is solid, then we will say, yes, we're going to move forward with vaccinating the public with this vaccine. If the science isn't solid, then I'm not moving forward. I'll just say that. I mean, and it may cost me my job, but
That's all right. Well, no, it's not all right. I don't want it to cost your job.
Okay. I just want everybody to be absolutely clear about that.
Right.
Because I mean, there's been a lot of talk. I mean, I have never been, and I've been in science for a long time. I've never seen a vaccine rush this fast, except for the swine flu, which happened during the Ford administration. And you know what happened with that. So I'm just saying that there will not be a rush, especially in our community, to vaccinate people until we are absolutely sure this is a safe vaccination. Now, the other thing that you have to be absolutely clear about, I don't mean to take up a lot of time, but the virus is changing its genetic makeup a little bit. So the vaccine that they're developing now may not be effective against the virus that's raging in 2 months. So that's another consideration I have to take into consideration, is that you develop this vaccine and now you say it's safe, and it may be safe, but it may not even be effective. So there's a lot of considerations. I'm gonna be what I plan, just like with the testing and everything else. We have to be absolutely clear to the public what we're doing and why we're doing it. And if not, it's not. And I was talking to Ronnie about this today. This is starting all over again with the vaccinations. We've got to be clear. It's got to be rooted in solid science. So that's all I want to say about that.
Excellent, excellent. Thank you. Now, this next question, and I tell you, I'm not going to do anything until you or Dr. Hill Daniel say I'm going to get it. Until I hear from either one of you, I'm not doing it. That's just it.
That's fair. That's fair. That's fair. That's fair.
So this next question is for anyone who wants to chime in. What do you think about the reopening of our schools or colleges after January?
Well, I can chime in.
They should go back?
No,
I know half of the parents want them to go back. I know, well, I don't want to tell you what I think, but yeah.
Let me tell you this for sure. It depends on what the numbers look like. So there are numbers that say, yes, you can go back. Like in New York City right now, the numbers say that school can open. They are at low risk. They have a positivity rate of about 1 or less. I think it's 0.7. Our positivity rate is now 4.1. It used to be 5.4. It has come. It used to be very, very high, but now it's coming down. But you have to. Those are different risk categories. So they have been solidly in a very low risk category for a long time. They're thinking about opening up their schools again. We're going to base everything we're doing on the risk of the virus spreading and us being triggered into a higher state where we get back to critical and we have to shut everything down. We don't want to go back there. So we've got to be sure that before we start opening up a whole lot of things, we're looking at the numbers. So I will not make any kind of commitment to what a school will do until I see what the numbers are. And we're being cautious and we're going slow, but we have to, because going back to your other question, but the folks in Prince George's County were hit hard because of a couple of really major things. And one of those things is that we have a lot of essential workers here. And our essential workers are on the front line, and they get COVID faster than anybody else. They get more COVID exposure. So that, of course, they get COVID. And then a lot of our folks, just like Dr. Hill Daniel said, are sick. And this COVID virus loves to attach itself to your heart, your lungs, and your kidneys through what they call an ACE2 receptor. So the folks who have diabetes are going to get it worse. The folks who are a little on the obese side are going to get it worse. The folks who have kidney disease going to get it worse. And so, and if you have heart disease, you may get over the virus and all of a sudden have a heart attack right after it, because it's going to it'll affect your heart. So we have to be, our populations have to be more careful than a whole lot of other folks, because our folks our people in Prince George's County have different work habits, meaning that they are more essential workers. They actually travel in and out of this county more than probably any other county, going into DC and Anne Arundel and everywhere else. Because, and a lot of folks go out just to get their health care, but they also go to all kinds of places for entertainment. And it's a lot of transit, it's a lot of transition in and out of our county. And one of the reasons we got hit hard is because a lot of that virus that mostly came from Europe, people had traveled and came back home from Europe and other places, and they started spreading in Prince George's County. People in Prince George's County travel. And so they bring things back. They'll go back down to South Carolina to see their grandmama's funeral and come back. That's what people in Prince George's County do. So we have to be Prince George's County has to be really careful about how we progress through this. And so you might hear some other county do this or some other state do that, but because we know ourselves, we're going to be very careful and make sure we go as slowly and as carefully as we can so that we can keep this virus contained, get rid of it ultimately. I'm sorry. I didn't mean to. I just want you all to understand those facts. Those are really important for our.
No, those are good points. Those are very, very good points. I appreciate that. I don't think you were fine. You were fine. I just want from, and I'm sorry, Chief, did you have anything? I just want from Director Gill. I don't know what that says. I can't see. I just want from, I know that it's 8 o'clock. I don't know what she said. I just want from Director Gill, what do we look like as far as our budget and our supplies and emergency management dealing with this pandemic?
I can't speak for the budget. What I can say is that the CARES Act funding has allowed us to make purchases, not just in EM, but across the spectrum to deal with COVID. And whether that's equipment that will get us through this event, policy changes that will get us through this event. The one thing, when I read down here, policies and planning, it's funny that it's on this list today. Dr. Carter and myself, we had a meeting today just to begin to prepare for the vaccine and the second wave. We wanted to talk one-on-one, and then we'll bring both of our teams in. And when we do that, we'll just develop the strategy, the planning, the direction, and then how they'll operationalize that as we move from November, December, January, and going forward, again, and then preparing for the vaccine whenever it comes. So I think when you're talking about where are we ready? The time we didn't have the first go around, we have the time now. We actually are working on an after action report, not to produce in 6 months, but for them to update on the lessons learned from February through April, May. We'll take those lessons learned to make sure whatever we did wrong in those 6 months, we have corrected to move into the remainder of the year and going into next year. So I really think we're in a good place, both as far as supplies, preparedness, policies, planning. all of those things tie in for a successful outcome.
Yeah, yeah. Well, thank you. I do thank you. I'd like to get some final thoughts from our chief.
Well, I appreciate that, Mayor. I think if I could say anything else, and as we go to the panel to get you all's final thoughts, first, let me say thank you all for joining us tonight. The level of passion that I've heard from each of you means a lot to not just me as the chief of police for the town of Edmonston, but as a resident here in Prince George's County. I remember hearing a conference call back in March with Dr. Carter, and we had never met, but the level of passion that I heard on that call about the pandemic and what we needed to do to prepare ourselves, it just meant a lot to all of us. So I thank all of you for what you do. You know, you all are definitely in my prayers, and this is not the end. These type of conversations are extremely important to our residents. You know, there's a scripture that says, "My people are destroyed for their lack of knowledge." So it's important to me as the chief that we continue to provide as much information as possible to get it out to our residents. If we were going to final thoughts, I'm going to go to each of you. Dr. Hill Daniel, final thoughts.
Final thoughts. I just want everyone to be safe. And like I said, if you're in doubt, if you have questions, please seek medical care. I don't want to plug my clinic, but we are right on Bladensburg. Come and see us. You know, we take anybody, you know, walk-ins all the time. If you need medical care, if you need help, just reach out. So
Yeah.
we're here for you.
Very good.
Thank you so
Thank
much. Director Gill.
Just a couple things. Number one, we're going to be in this lane for a while, and it's important for Chief, for your staff, Mayor, for your folks, and I'm talking about employees, to make sure they're taking breaks, that they're trying to take some time off. Most of us have lived here since February, and we realize we're going to be here going into the next year. So don't let it get to the point where you stressed out, your staff is overworked, because you know, this is not a sprint, this is a marathon. The second thing is, and I told this to Dr. Carter and his mental health professions, it got to the point where I felt like this was Groundhog Day. I just woke up and we did the same thing over and over.
Right.
And in reality, we're still doing it. So if you need to take some time, realize the importance of mental health, and this goes back to what you said, Chief, earlier. I want the residents of Edmonston to know that Dr. Carter and myself, along with the rest of this team, has their best interests at heart. So we may not get it right, you know, the first time, but we're going to do whatever we can to fix it and move on, because again, this pandemic is new for all of us.
Yeah.
Wow. Yes, thank you. And last but certainly not least, Dr. Carter.
I have to just go along with what Ronnie said and what Dr. Hill Daniel said. That's right. Well, I just want everybody to just stay smart and make the safe choices. And you all know about wearing the mask and staying 6 feet apart. But the most important thing is to know that we've come this far by faith, and we're going to get all the way through this. That's what my father's favorite song and line to me. Every time I was in a difficult situation and I was driving home with him from his work, and when I was a little boy, and I would say, I don't know how I'm going to do this, Dad, he said, you've come this far. Faith. And so we're going to go all the way through this. Oh. That's what we're getting ready to do. And I feel, and I know, because Ronnie and I, we're basically one person. That's how we feel every morning. That's why we get up every morning at ungodly hours and go to bed at ungodly late hours, because we know that by faith and by this community, we're going to get through this, and we're going to be a lot stronger. we're going to be a whole lot stronger. We're going to
Yes.
do creative things that will put the infrastructure we need in. All these things that we're finding out that's a problem, we're going to work on to correct. And at the end of the day, we're going to be the Prince George's County that you all want us to be. So that's why we're here. And I just feel so grateful that you all have had me on. And the only other thing I want to say to you is, and thank you so much, Chief, is that the Prince George's County has been very good to me as a health officer. A lot of health officers are quitting left and right. Because this is a difficult work, but Prince George's County has been good to me. I just want you to know that it's been good to me as a health officer, and I don't intend to let you guys down. So having said that, I'm going to sign off to Chief and to Mayor again, and that's my final word.
Thank you, Dr. Carter. And I'm going to ask that our mayor close us out.
Thank you so very much. I'm honored. I am very, very honored to have you all here and your closing thoughts. I greatly appreciate each and every one of you, your expert advice, your expert input. The county is so much greater to have each of you a part of it. Dr. Carter, Director Gill, Dr. Hill Daniel, I'm so thankful to have met you all, and just I have gained so much tonight. Your input is just it was tremendous tonight. Thank you so much. And those who have listened on, I hope they have just learned so much. You were up front. You've given us just so much. We are blessed tonight. Thank you so very, very much. And this will play. So so many more hopefully will listen and take every bit of what you've given us tonight. Thank you a million times. Thank you. I want to tell you about our upcoming Edmonston Talks next month, October the 21st. We'll focus on business and the economy. And that, again, that's October the 21st. And then November the 18th, we'll focus on essential workers, and we'll celebrate our town heroes. And that'll be in November. And again, thank you so very much for tuning in tonight. And thank you for being present tonight. I'm telling you, I feel blessed to have you here tonight. This was a wonderful topic. Wonderful, wonderful, wonderful. We have the best representatives here tonight. So again, thanks so much. And thank you for those who tuned in. And I thank you, Mr. Gray and Miss Avery, for your expertise tonight. Steel Beach, yes. So everyone have a very pleasant and blessed night. And thanks, Chief, my right hand.
Thank you so much. Good night, everybody.
Good night.
Take care.